I think it's definitely going to be repaired, not replaced. But more importantly, healthcare was such a high priority during the campaign and the midterms that I believe that the Democrats are going to put a high priority continuing to not only repair Obamacare, but also to expand healthcare alternatives, particularly government subsidized alternatives that have the characteristics of Medicare and Medicaid. Obviously not affordable to do Medicare for all, but there are many things that can be done with innovation.
Drug pricing, the need to curb it, it seems to be one of those few bipartisan issues that maybe this Congress could decide upon. What do you expect in terms of that, and why do you think healthcare stocks have been rallying in light of that fact?
Well, I think healthcare stocks have been strong really all the way back since 2014. I mean, the health insurance industry for many of the largest payers are up over 300%. But what I find interesting is that now the big health plans are really taking seriously the important role of innovation. For example, McKinsey Global Institute has estimated that there's $900 billion of fraud, waste, abuse, misuse, and avoidable expense. $900 billion out of $3.5 trillion spent each year. And a lot of that is huge administrative inefficiencies. And for instance, at our company, RX Advance, we'll do $10 billion of contracted revenue this year because we're focused on a role in innovation for automation, which is called transaction platforms, that is literally changing the landscape and the possibilities of being able to bring down drug costs for prescription drugs, being able to take inefficiencies out of this immensely large healthcare system. And I think it's going to start getting politicians' attention.
John, it's hard enough to drive waste and inefficiency out of a single company. It's really hard to drive it out of U.S. healthcare writ large. So is it even reasonable to expect that legislative action can begin to do that? What are the forces that need to kick in order to start driving towards some of that that greater efficiency that you say is going to get us to the point where we need to be in driving the cost down?
Well, let's just take one sector. Let's look at the huge political attention that has been given over the past year, in particular to pharmacy benefit management as being a middleman, which is very opaque, that charges rebates and spreads, and no one's quite sure what its influence is on the actual consumer pricing of prescription drugs. Well, the reality is that there is innovation going on. We're one company, others are working on their solutions, that is taking automation to an entirely different level that can take the complexity of thousands of rules and being able to bring in machine learning and being able to bring in transaction platforms that are able to open up the whole pharmacy benefit area and say, look, we don't need to take rebates anymore. We don't need to take spreads. We can give transparency to pricing. And those types of things is going to get the politicians' attention. And there's going to be a lot of, I think, increased awareness of just how much innovation is available to the healthcare industry today that just wasn't around a couple of years ago.
John, I want to dig into that point just a little bit more in terms of the PBMs. So when critics, including HHS Secretary Alex Azar, say PBMs are to blame for high drug prices, you're saying that there's already changes taking place among PBMs that are starting to cut those costs?
No, I didn't say that. I said there was an opportunity to cut costs. In the case of RX Advance, I believe we're the first ones to say, look, we can bring in so much lower cost of the way we perform the PBM process that we don't need to charge rebates. We don't need spreads. We can do it just because we're so much lower cost. We're working together with our partner Centene. Centene's a $70 billion health plan, focuses on the government side of healthcare, particularly Medicaid. And they already learned how to make profitable the very difficult Affordable Care Act exchanges. Well, now as they've started to onboard and roll out what we're doing at RX Advance across their 27 health plans, it means that they can become even more aggressive. And it's one of the reasons why you've seen Centene stock, I think, has continued to grow over the past year. And while they're so well poised for the big attention that I think the House is going to give towards, there's got to be a better way to deal with the high cost of health care.